focus so closely on that area up here is because that's the channel for life to make it from the brain out to the body, and we want to make sure it stays out. Okay. Let's talk about the 6 factors of health. Basically, things so that outside the clinic here, we can get the most out of this. And in addition to chiropractic care, see you next time.
See ya.
But the 6 factors we have to take into account to get the most out of this when we're outside of here. Number 1 is drinking plenty of water. All right, plenty of water. So our bodies are at least 50% water. When we're born and when we're babies, we're about 75%. Right? So as a rule of thumb, we need to be drinking half of our weight in ounces every day in water as the norm. All right? So if I weigh 200 pounds, I should be drinking 100 ounces of water.
No way.
Yep. Yeah, at least. Because our bodies are at least 50% water. And when we do that, we're staying properly hydrated. That's going to make our organs healthier. All our cells are dependent on water for hydration. It's going to help our immune system as well. It helps us be more overall healthy. So water is number 1. Number 2 is getting plenty of rest. All right. This is going to vary from person to person, but some people we can all think of are good with 4 or 5 hours of sleep, bounce up in the morning, good to go. Others of us need 8, 9 hours of sleep to get going, right? But regardless of how much we need, in order for our bodies to heal, it takes energy. And in order to get energy, we need to sleep. And so if we're constantly burning the candle at both ends, not getting enough sleep or getting enough rest, we're not going to heal near as quickly, and it's going to take a lot more time. So rest is important. The 3rd factor is exercise. Right? Now this is going to vary from person to person as well. We have patients in our clinic who are training for triathlons. We have some patients in our clinic who are just trying to walk to the mailbox and get their mail. So, but regardless, getting at least 20 minutes of exercise 3 to 4 days a week is gonna help the overall wellness of our body. Dylan, I know you're on the go constantly. You probably don't have to think about taking time for exercise, but especially even as we get older, though, what exercise does is it stimulates our nervous system to produce serotonin, dopamine, those feel-good hormones. Research even shows that exercise 20 minutes a day, 4 days a week, can take the place of up to 2 depression medications. Right? Just because we're getting our natural neurotransmitters and those feel-good hormones going. The other thing exercise does is it regulates our blood sugar and things like insulin dependence and diabetes. By exercising, we regulate our blood sugar and insulin, so that helps our tissues and cells heal as well. Okay, so exercise. The 4th factor is eating the right foods. Right? We can spend about 3 different classes on this alone, but as human beings, we're designed to be hunter-gatherers, almost kind of like cavemen, so to speak, where we depend on lean meats, fruits, vegetables, nuts, and seeds. That's the main things we're supposed to eat. It's hard to get that type of diet in our suburban lifestyles, so what we talk about is hunting and gathering on the outside aisles of the grocery store. There's really nothing that we need to survive on the inside aisles of the grocery store. Staying on the outside aisles where the produce, the meats, the fruits, all those things are is where we need to eat a majority of our food from. And if something could stay on a shelf for a year or 2 and still be edible, it's not food. We really shouldn't be eating it. If something has ingredients in the little ingredient box that we can't pronounce, it's not food. We really shouldn't be eating it. Food should have a shelf life of a few weeks. And, it should have natural enzymes in it that break it down over time. But those preservatives and lack of enzymes is what allows food to stay on the shelf for 2 to 3 years at a time. We want to stay away from that as much as possible. So, if it didn't have a mom or come from the ground, we don't need to be eating it. But that's going. We'll get to that point. But for now, let's just focus on staying on the outside aisles of the grocery store. The 5th factor of health that we need to take into account, and this is one that a lot of people don't think about, but our thoughts, what we have inside of our head. Right? We've all probably experienced the concept of our shoulders getting tight during a deadline or during a stressful period. That's a thought. That's something between our ears causing a physical response from our body. So what we keep in between our ears is going to manifest on our outside bodies. And so surrounding ourselves with good influence, good people, what we want to stay away from is what's called stinking thinking. Right? What stinking thinking gets you? Stinking results. And we're going to attract what we we're attracting to our lives what we keep in our head. And the way we get things in our head is from what we see, what we hear, and the people we surround ourselves with. And we can all probably think of that coworker or that friend or that colleague who maybe, it just seems like bad luck follows them everywhere. Or if they didn't have bad luck, they wouldn't have any luck at all. And you can kind of start to see some characteristics of those people. They're usually pessimistic. Usually nothing's their fault. They're always putting it on somebody else's fault. They're going to track that into their life. They're usually sick a lot. They're usually taking days off of work a lot. And so, again, surrounding ourselves with positive influences is going to keep our headspace right to be healthy too. Right? So that's another factor. The sixth factor, and really none of the other five we talked about, matter without this last one, and it's what we already talked about: nerve flow. Our brain needs to be able to effectively communicate with our body for all those other things to work. For example, say we eat great. Say we eat organic produce and we eat grass-fed beef, and we have a subluxation. And so the brain is only sending maybe 60% of the signals down to our intestines. Right? So we can't properly get and absorb the nutrients from that food. Somebody could literally be out eating McDonald's and Wendy's every day, getting more nutrients than us because they don't have a subluxation. So making sure that the brain is communicating properly with all the organs is going to allow all those other things to be added into our lives to increase the process. Okay? So that's a big part right there, is keeping our nerves healthy. One thing I always like to just kind of wrap up our talk with is just my own story on how I became a chiropractor. A lot of people wonder, what made you want to even do it? And I grew up in a small town in Montana. Anyone here been to Montana? Yeah, you did. Okay, that's right. Yeah. You guys ever been to Montana? It's way up north by Canada. It gets cold up there. Kind of like it has been here lately. Yeah. But it was a ranching community. All of my family and friends ranched around there, and so every spring was branding season, and so the newborn calves had to be branded, get marked, and so we had to separate them from the moms and herd them into a pen and get them branded. And to do that, we'd either get our horse or four-wheeler and take them around to the pen. And I was herding some calves around a hill on a road, and the embankment gave away underneath the four-wheeler I was on. And it actually rolled over me with it about 3 or 4 times down a hill and then off into a little creek. And so it was rough. And being about 14 or 15 years old at the time, your bones are rubber and you're invincible, it seems like. But nothing was, broken or fractured, and I was okay, thank goodness. Was unconscious for a little bit, but nothing was broken. And so I just got up, dusted myself off, and went on with the day. Finished the branding. What ended up happening, though, was about 3 months after that incident, I started developing chronic back pain, chronic migraine headaches, really bad sinus and allergy troubles, really bad digestive troubles, even like constipation, diarrhea, all these things that I'd never had before, and aren't normal for anybody, but especially a 14 or 15-year-old teenager or any teenager. And so I started going everywhere. I started going to specialists. I started going to neurologists, orthopedists, primary medical doctors, physical therapy for rehab. I was going to all these different places for a good year and a half, and it kept getting worse and worse and worse. And they would take, X-rays. Nothing was fractured or broken, so they'd say, you're fine. They would do blood work. Nothing was outside of the pathological limits, so they'd say, you're fine. You just need to keep stretching and icing and taking these medications. That wasn't working. And so finally, some people told my parents that they heard maybe to try a chiropractor. They heard chiropractic could help things like that similarly in the past, and we'd been everywhere and nothing was working, so we thought, why not? And at the time, I thought chiropractors just popped bones, cracked backs, and jumped on people. I had no idea what a chiropractor did. But nothing had been working. The closest chiropractor was about 70 miles from my little hometown. So we drove to this place, and they took x-rays of my neck. They took x-rays of my low back, and they showed me how my top bone was off. My head was not on level anymore. My hips were higher on one side, so with every step I took, muscles were going to be pulling unevenly, and there was a disconnect in the way my brain talked to my body. And so it made sense. Finally something made sense. And so I started going there 2 or 3 times a week in the beginning and getting adjusted. And within about 2 months, all of a sudden some of those symptoms started to regress, started to go the other way. And within about 4 months, they're completely gone. things that have been going on for over a year and a half and not getting better, and after being to every hospital in the area, they couldn't figure it out. And so, you know, it changed my life, and I knew that that's what I wanted to do at a young age, is be able to do that for other people, just like you guys are here. And one of the reasons why, you know, I make it such a requirement for people just to come and hear this message is because you're not going to hear it anywhere else. You're not going to hear that health comes from the inside out, not the outside in. You're not going to hear it from the pharmaceutical commercials that we get inundated with every day on TV, right? The purple butterfly putting us to sleep, or the cholesterol drugs, or whatever medication it might be. You're not going to hear that. We really, absolutely, those things save lives every day, but that's not how we get. It's not how we get healthy. Health comes from the inside out. We don't need anything added. We just need no interference in the way things function. And if we can catch these things earlier on, we can keep them from becoming worse in the future. I wanted to show you one example here of that, of the stages of degeneration. And this here is what a healthy spinal segment looks like. You can see the disc, you can see the nerve coming out here. That's what we want. After we have that trauma or that accident or that injury, it turns into this, where now the disc starts to swell. The space for the nerve starts to get smaller. All right? This is a 3 to 5 year process to get here. And if nothing's done to correct it 10, 12 years down the road, you can see here how the bone starts to change shape. The spaces for those nerves get smaller, those nerves start to get pinched. And this right here is usually when people start noticing pain, when it's in this phase. And for 80% of our patients who come in here, they're in this phase 2 when they come in, and that's 10 to 12 years down the road. So the problem's been there for 10 to 12 years, and they're just starting to notice pain. So again, it's not about how we feel, but it's how we're functioning as a whole, and why we can't just gauge our health based on, you know, not having symptoms. That's a big thing too. So usually, as we're wrapping up the class, what ends up happening is, you know, maybe something came to mind, somebody in here, you thought of a family member or a coworker or a friend with some things going on. Maybe they're trying to avoid a surgery, maybe they're trying to avoid medication, and instead of, you know, staying an extra half hour of the lunch break and going over that, what we allow people to do is, if there's anybody you thought of, write their name down on one of our clipboards here, and what we'll do is we'll actually send them some information on chiropractic. There's also a little survey here that you can grade this to. And what we'll actually do is, if they live around here, we'll send them a certificate for a free exam and x-rays so that they can actually come in and see if chiropractic can help them. Lou, I think you already did one of these, so yeah. If they live in Anchorage, Alaska, or Jacksonville, Florida, you know, we want to help them too. And so we'll send them information on chiropractic so they can also, you know, understand this and find somebody close by them. But if y'all have any questions at this time, you know, please let me know. I know we went through a lot in a small amount of time, but if there's anybody you can think of in this area, you know, write their name down. We'll send them information on chiropractic. We'll send them a free health pass to come in to get x-rays, exam, and a consult for free, just to see if chiropractic can help them. And if it can't, we'll let them know, but if it can, we'll let them know what's going on.